Okay. Can everybody hear me? All right. All righty. Well, good morning, everybody. Good morning. I see a lot of familiar faces out and about, some new faces. So it's nice to see y'all walking around and out and about in the village. So we're going to talk about, this is our coffee with outpatient therapy, and we're going to be going over essentially how speech, occupational, and physical therapy support healthy aging. So good to see all y'all. And then also anyone, this is going to be on Knox TV. I believe it's tomorrow on Knox TV. So anyone who's not here tuning in to see it, thank you for tuning in, as well as on the YouTube channel. So I appreciate that. Okay. So who am I? So I go by Chris. I've always went by Chris. Some people see William and they always ask me, how the heck do you get Chris from William? So middle name is Christopher. Never really been called that ever. My mom only calls me Christopher when I'm being a knucklehead. So it's always been Chris. I am our outpatient therapy supervisor, and I'm also a physical therapist assistant by trade. So I graduated from Daytona State. My second clinical was here at John Knox Village at Majestic Oaks. When I was through there, I pretty much had an immediate job offer as soon as I got out of school. So that's what I did. Came in because I loved it here so much. I started at Majestic Oaks. I was there for about 4 years. And then coming up this year in September, it'll be approaching 3 years in outpatient. So it's a total of 7 years for me here. And I've really grown to really love not only the people I work with, but also all of y'all. Everyone that I get to see out about and then smile and wave to every day. It's really been a blessing to be here. So our agenda is we're going to be talking about what is outpatient therapy, just as a whole. What is the overview of speech therapy, which up here you'll see speech-language pathology. Speech therapy and speech-language pathology are synonymous, so they mean the exact same thing. We're going to go over overview of occupational therapy, overview of physical therapy, how they work together, our outpatient therapy programs, as well as how do you get into outpatient therapy. And then at the end, if you have any questions, I will do my best to answer all of them. So what is outpatient therapy? So big difference between outpatient therapy and then Majestic Oaks, or what is also called inpatient therapy, is you get to see us for 45 minutes and then you get to go home. With inpatient therapy, you're there staying the night, getting treatment at Majestic Oaks. We're also located in a different building. Majestic Oaks is that big building when you come through usually the main entrance of John Knox to the right. We're further down the road. We are actually in the center, the building right next to this one. We're in the old fitness center, and in that old fitness center, y'all can come in and exercise. Even though we operate out of there, you can come in and exercise anytime you want. The nice thing about us being in there is if you have any questions, you can just ask us. We're there to support. So as far as that, what do? We focus on function, improving independence, and then that's at all levels. That's speech, occupational therapy, and physical therapy. What we're going to do is in all of them, we customize every program to your goals. So every plan of care is completely customized to yourself within outpatient therapy. Some terminology you may hear with outpatient therapy is it's called a clinic or medical offices or therapy centers. We're basically a clinic. So we would be an outpatient therapy clinic. We also will go by outpatient therapy gym. So why does outpatient therapy, though, matter as we age? So it helps you maintain that independence. As we age, if we're not necessarily exercising as much, our bone structure, our muscles, they start to go down. And so having some specialized therapy can really address some of these deficits to keep all of y'all moving around and being as independent as possible. So some of those things would be like reducing pain and stiffness that occur, improving your balance so that way we prevent falls. That's a big one because then if we can help prevent the falls, then if I fall, because I'm goofy, I sometimes trip, but I catch myself. I have that speed and ability to do so. So as we age, some of our power or speed kind of goes down if we're not training it. And if, as we age, we take a fall, there's a higher likelihood that we might actually hurt something. And so if you're starting to notice that we're having a little bit more difficulty walking or moving around, coming to us at outpatient therapy is going to be really beneficial, because then we can help prevent that fall that may take you into the hospital, that may take you into having to go to Majestic Oaks. And again, over there, great facility, but you don't get to go home until you're ready to go home. So over at outpatient therapy, you see us for 45 minutes, and then you can go about your day, go home. You can go right across the way and go to the Scoop, get an ice cream. So you got that fun ability with us. So other ones at outpatient therapy would be with things that speech therapy hits. Your ability to communicate, whether that's going words out, processing in, so you can be able to concentrate and think and do daily tasks. And then we keep you active in the things you enjoy. My last presentation was about that, as far as any specific things that you enjoy that you can't necessarily do anymore. We have tailored programs, and we'll talk about that later in the presentation, as far as those tailored programs that really help out, get you back into those things that you love to do. So our first one we're going to talk about is speech language pathology, or speech therapy. So in this little image here, we got quite a different few things going on. So we have a gentleman working on essentially how to reprocess and remember as far as how to say words, word finding. And this may occur after things like strokes and things like that, where some systems need a little bit more recalibrating. But what we also have is that you can see speech therapy doesn't just work on speech. So we have a few different things of posters as far as swallowing health, as well as cognitive health support, because they play a big role in those functions as well. There we go. So speech therapy to me is what I would say is our most important therapy. And why is because there's a couple of fears that I have. As far as my fears that I have for myself is that slowly kind of adapting dementia, kind of losing my mind a little bit. Also, my other biggest fear is if my spouse does, and having to go through that. So with those fears, I know that with myself, I don't already have a great memory. I write everything down. I have to write everything down. That way I remember to do tasks. I set reminders in my phone, so that way I remember everything, because otherwise I don't. And that's already where my memory is. And I've made a promise to myself, if I see that start to slip, if my friends and family see that start to slip, and so a lot of times they're usually the ones that will, and if they mention that to me, I'm immediately going to go see speech therapy, because they have the tools to be able to enhance that ability for cognitive processing and really help that. Another thing that I love to do is I love to eat. I love to eat, and everyone knows in the office I am the human garbage disposal. So if anyone has any food they don't want, they usually give it to me and I eat it. Well, because I love to eat, if I start to develop and like I notice that I'm having a hard time swallowing, foods, swallowing drinks, coughing, and aspirating, I'm immediately seeing a speech therapist. I don't want to lose my ability to eat. I don't want to lose my ability to enjoy what I like to do is eat. So I would be seeing speech therapy for those reasons. This is why I really do believe for myself as well, speech therapy is our most important therapy service. So like I just talked about, we have the speaking clearly, understanding conversations. So not only how we speak out, but also how we receive it in, how we process what we're hearing, so that way we can communicate with each other and that way we can connect. So those are really important. We have the memory and problem solving. Those are going to be very important with how you do tasks. So they can work on how the mind processes, while maybe the other disciplines work on the physical. They also have that swallowing safely, which I talked about, and then voice changes. So not only voice changes by how loud you speak, because some people might be speaking really low and you can't necessarily understand them. Speech therapy works on elevating that volume, as well as going ahead and getting the voice clear. So if you have hoarseness in your voice and it's a little gravelly, speech therapy can actually help get that clear so you can better communicate with each other. So common reasons that I talked about, like with our picture, stroke might have occurred. Other neurological conditions that affect the processing, speech, or even swallowing. These conditions can affect any one of those. If you have, with that, any memory or word finding problems, just in general, not having a neurological condition, but just starting to have dementia, these things can be worked upon. Like I said, with the swallowing food, the coughing or choking while eating, that's your telltale sign that there's something going on there that speech can work out with. And then difficulty in following those conversations, which we touched upon. What happens in a speech therapy session? You're going to get your evaluation first. That's your very first thing. For them, that is that communication and memory assessment. So they're going to go over that. They're going to see where your strengths are, see where your weaknesses are, and then be able to design that personalized plan for yourselves to go ahead and give you that plan of care to help elevate where you're at. You might get with that speaking and thinking exercises if it's necessary. If it's necessary, you might have the swallowing safety strategies. If it's necessary, you might have family and caregiver education. Depends on where level you're at, because we adapt everything to where you come in. And some people, they're at a level where they have a caregiver, and they may need a little bit of that caregiver education to better support that individual's care. So they give that as well. And also, not only do the programs work to elevate where you're at, but you get personalized home practice, so personalized home exercises that you can do on your own. That way, when we elevate, you can then help and maintain. So that way we prevent any decline. The next therapy is the one I like to call the jack of all trades, because they're really important, occupational therapy, and they touch upon a lot of things that physical therapy does, but they also have the cognitive that speech therapy does. So they really do branch out into all the different disciplines. Here we have a fairly muscular individual here on the table, and he's got elbow and shoulder problems. And so you could be working out, you can be exercising, be in shape, still end up having some pain that occurs. And if you do, therapy can help take care of that. And then for us, occupational therapy here in this picture can help take care of that, to get rid of that pain, that stiffness in that joint, so that way they can get back to enjoying the things that they like to enjoy without that pain. So occupational therapy helps you do everyday activities safely and independently. So one of the jokes that with occupational therapy is, why do they get their name? Because I don't work anymore, I'm retired. I don't have an occupation. Well, your daily tasks are also called occupations, and that's where they get their name. So they really do help with task-specific training very well. They'll help improve how your body moves overall as well, just like physical therapy will. They're going to help support recovery from injury and surgery or illness, just like physical therapy will. Improves independence at home and in the community. Really important, a lot of, again, just like physical therapy will. And you're hearing me say that a lot because we'll get to it, but a lot of people know and understand physical therapy. OT is the one that needs some elevating as far as what they do. And you'll see in this next few slides, they'll do all these activities here where they help with, these activities that they can specifically train. But in all these activities, there's muscle functions that they can target as well. So dressing and bathing and grooming. There might be some issues with shoulder pain or stiffness, elbow pain that they can work on. Cooking, meal preparation, that's task specific. They can, not only the movement in that, but also the cognition component in that they work with. Writing using phones and computers. Really their hand dexterity, how well they're able to maneuver their fingers and to able to use and hit all those little buttons. That's important, and this is where occupational therapy, I would say, definitely gets more of the overall training, is physical therapy can work on hands. Occupational therapy gets more actual training to work on hands, and so that's more of their specialization. Whereas physical therapy, their really specialization will be more of looking at how you walk, how that gait training. Occupational therapy pretty much covers about 90% of what physical therapy does. And they overlap tremendously. Another big part of it is any other household tasks, such as, and then you also have the managing the fatigue and energy. That one as well. Basically, physical or occupational therapy that can look at different strategies to manage your energy when you do a task. At the time you come see us, you may be doing a task and you're not able to do it for an hour because things start to hurt. You have less energy with doing them. We can go ahead and look at and adapting ways and managing time to be able working at 30 minutes, and then over time we're able to elevate that with training progressively. So as far as those common reasons, and this is why I say they have a lot of overlap with physical therapy, is they'll work with the hands, which you talked about, and they do have that training more than I would say physical therapy does. But they're able to work on the elbow, shoulder, neck, back. They're able to work on all of these, and they work on it just as well as the PT does. So we're able to have you either go to occupational therapy or physical therapy. No problem when you have any of these deficits that are going on. Any recovery from stroke or injury, occupational therapy can play a role, especially if it's in any of those, upper body deficits that are going on. Arthritis or joint stiffness, they're going to work with that. They're going to help with getting rid of the pain, helping with the mobility in those areas that you have arthritis or joint stiffness. Vision or memory challenges, this is where they touch into the cognitive component that speech therapy does. And so they're able to help with those tasks. Need for adaptive equipment. When you're coming in to see us, there might be a need for some adaptive equipment to help you do some tasks. And then they're able to find the right equipment for you, as well as work on training to get your ability up to potentially not even need that adaptive equipment. But for the time being, you may need it to go ahead and do these tasks. So what happens in an overall OT session? Again, you're going to have that evaluation. That evaluation is going to look at not only the daily activities that may be affected, but then also your overall movement quality. So they're going to take a look at essentially overall, again, those strengths, those weaknesses, customize a plan to show you where you're at. Here's the things we don't need to work on because you're good. And then here's the things that we do need to work on, because that way it helps you achieve what you want to do. With that, you might get some practice of real life tasks, because they might play a role. It's like I said, if you have some shoulder problems, they might find that you might have a difficult time with trying to reach up, grab things in the kitchen. So they can work on these different movements from high, low, side to side to help get that healed. You're also going to have strength and mobility programming, which is going to be a part of more likely not trying to fix what is going on. You have that training with adaptive tools if necessary, and then your home safety education. That's going to be a part of like your home exercises. So they'll also give you home exercises not only to do to help with your recovery, but then when you're done to maintain those levels. So we'll help give you information and guide you to different ways to help keep up your abilities, so that way they don't decline, and that way you don't have to come and see us so often. Strategies to make tasks easier, that's overall, that's what we're looking to do. We want to get you to be more independent, have things easier so you enjoy your quality of life. So this is the one that we all pretty much know. Most people know. Most people actually know it so well, and we definitely feel the appreciation, love. A lot of people come in and they actually call the gym the physical therapy gym, which does make me chuckle, and I do feel the appreciation and love. One of the things, though, is I do want to just clarify that as far as when coming in, with us, because we have all the services, we're really an outpatient therapy gym. We're an outpatient therapy clinic because we do have the speech, we do have the occupational therapy, and it's nice to call it that because it shows them the love as well. But every time it's said like this is physical therapy, it makes me chuckle, and I do feel the appreciation, because we're really well known, and we do appreciate it. I did my best to try to get Kyle into this presentation. So if anyone's ever seen our physical therapist, he looks sort of like that. So that is our Kyle, and we have him working on this individual, and they're having some hip issues, helping with their walking ability. Physical therapy is going to help improve how your body moves. And we're going to be able to work on that with pretty much any body part that we got going on. That may look like focusing on things of strength, things of power. And then power is how quickly you move something. It's how quickly, so strength is how much weight can I move, let's say with my leg. Power is how quick I can move it and keep myself upright from falling. That's your power. With that, power plays a huge role in your balance. As far as if you lose your balance and you're getting tipped over, if you have the power in your legs to step out, you're able to keep yourself from falling. So we work on that as well. You're walking. That is that one that I said is a little bit more specific to physical therapy, is really gait analysis is what we call it. Really analyzing how an individual walks and where do we need to target to get that better. And just your general overall mobility. That's what we help out with. That can be with pain, stiffness, lack of strength, power, those things that I listed. We're going to help support your recovery, injury, surgery, and illness, just like I just said OT would too. That's why I constantly am saying they're really one and the same, and they have really almost like a 90% overlap with physical therapy. So common reasons: shoulder, back pain, back, hip, knee, or foot. These are different areas where we would work on with physical therapy. Now, can we work on necks? Absolutely. We can work on necks, no problem. We can work on hands, no problem. A lot of the overlap is going to be really dependent on, like, when you come to see us, your referral might say physical therapy, but the physical therapy caseload might be pretty full. The occupational therapy might be a little bit lighter. We'd ask you, do you mind seeing occupational therapy? We'll check with your doctor. Do you mind seeing occupational therapy? That way we get you in sooner and take care of what we need to take care of with you, because they're able to do exactly what PT is able to do in majority of everything. So with PT, like I said, with the OT, arthritis, joint stiffness we work on, balance problems, frequent falls. That's important. A lot of times if someone has a fall, you're usually getting a call from me, because I'm the one who does the independent living fall screens. So if anyone falls, you're usually getting a call from myself, checking on how you're doing, see where we can focus on and maybe get you in to see some therapy to get you to reduce those falls. The latest statistic I saw that was with falls, when you have a fall, it is 66% chance within 6 months that you end up falling again if you don't do something about it. So we want to prevent that. We want those numbers to go down. So we definitely want you to come in, see us, at least get an evaluation, because in that way we can really just see, do we have any weaknesses? Or was this just I wasn't paying attention? Because if you have some weaknesses, we can correct that to help you not fall again. That after joint replacement or surgery, that's just like I said, if you have like knee replacement, if you have even shoulder replacement, physical therapy can work on any of those. Definitely get your mobility back after that knee replacement, get that strength back in that limb after that replacement to keep you moving pretty much the way you used to move way before you even thought you needed a replacement, because you're pretty much getting that whole new joint. You should be walking and doing things again, because usually when you think you need a new joint, you're already not walking the best. So we get you back to before that, where things were good. Overall, like I said, that difficulty walking or standing. So if you have that difficulty standing, because it could be back pain, we can work on that. OTs can work on that. It doesn't really matter. Either one can work on that. Difficulties walking, we probably would work on that as for the physical therapy side, because of our a little bit more what we dive into with that. But you may have an OT and you might work with walking as well, because they'll work on it with different tasks specific with walking. So what happens in that PT session, that evaluation, and it's going to look at overall movement quality. You're going to look at movement and a strength assessment. Through that, you'll get those exercises tailored to you. Can be looked at as specific exercise for strengthening, mobility, you name it. Balance and walking practice you'll get if it's necessary, if that's what you're coming in for. We're going to really take a look at that, see where we need to actually improve, see if it is a power issue, See if it is a strength issue. See if it's just mobility. A lot of times it's just mobility. A lot of times it's my ankle does not necessarily stretch as much as it should, and so I'm not necessarily able to pick up my feet to take those steps, get those toes pointed to the ceiling so I can hit with my heels. Sometimes that's the issue, is you just have a mobility issue that we need to work on, and that'll make you safer. Pain relief techniques, if pain is the issue, they'll work on that. We'll reduce pain so that way we can get you moving better, because that might be the only issue, is you have pain. And get rid of the pain, you move a lot better, move a lot safer. Education on safe movement at home, if necessary, we definitely actually can go do treatments in your home. So if you have where most of the falls occur in home, we might do treatments in our therapy gym, but eventually we're going to want to take a look at home, because we're going to want to see, how do you move about at home? How's the setup going? So we may ask, do you mind if we do treatment at home? Take a look and see if we can go ahead and solve some issues that might be going on there. So we can do that as well. And then those home exercise programs, like I talked about, same thing. You get it so that way it helps with your recovery, and then when you're done with us, if you keep doing that, you're going to keep helping maintain yourself so you don't have a decline. So a little bit of the overview of how they work together. You have that speech therapy, which improves the communication and thinking. And then OT, that cognition. So there's that key with speech. Daily activities and movement. Physical therapy is also going to play with movement, and then in balance. So you can see how they're all kind of connected in that little line. That whole team approach, that whole person care, that way it can improve anything that you need to go ahead and keep with that quality of life. My real life example is going to be a fall. So let's say with the fall occurs because of something that maybe with, like, there's dementia, and so a little bit of cognitive processing is a culprit of why you fell. So speech, they're going to work on that memory and safety and awareness. They're going to work on helping with the brain so that way they gets that better. OT, let's say when you landed, you hurt your shoulder. So now the OT is going to want to be involved so that way they can help heal that shoulder, so that way you can go ahead and maneuver better. PT, let's say when you landed, you also land on your hip. So now you have PT working on your hip, working on your ability to take better steps, get you walking better, while OT's focus on the shoulder, ST's focus on the brain. So that way, when they all work together, we can elevate where you're at and get you back to being able to move safely. Our outpatient therapy programs that we currently have: aquatic therapy, which is run by Kayla. She's our other physical therapist assistant, and right now she's doing a great job with running that. The weather is getting warmer, so even a better time to hop into the pool. We have lymphedema, we have scoliosis, and then we have reach. Reach is that last presentation that I had with y'all, and that was resuming engagement in activities that create happiness. And I will talk about that in a few slides of what that really is. So some of the benefits of aquatic therapy, because of the pool, reduces stress on the joints. So it's overall reducing that stress so that way you can move more comfortably. The water temperature plays a role in that. Water temperature helps relax the muscles, so it helps alleviate some pain that you may be having. You can improve your strength and endurance in the pool, as far as the water adds resistance to you, at the same time decompressing joints. So it's a lovely tool to get into the pool with. And then you can enhance your balance and confidence. It's really hard to fall in a pool, like really hard to fall in a pool when you're already in it. So one of the things is that when you're in there, you can improve your confidence as you're moving, get stronger in that pool, and then we can start to move exercise back to land. It's a great tool to start out with, get things feeling more comfortable, get you stronger, and then get you back out of the pool to do some exercises there as well. Lymphedema. So I am lymphedema certified. I got that last August. With lymphedema, essentially there is some type of fault in the lymphatic system, which is what plays a role in your immune system. And so usually what it can be is that there's maybe a lymph node that gets removed in a surgery, maybe a lymph node accidentally gets nicked. Something of the lymph system in some part of the limbs of the body is not working quite right. And so, for example, let's say that's in my shoulder. My shoulder starts to swell up. It's because it's not moving lymph fluid back into the rest of my body. So my arm is now swollen. Well, that can be uncomfortable. That can be heavy. And it also, because it's swollen, it actually hurts the immune system. So it's actually a little bit more prone to infections. So lymphedema treatment looks to reduce that swelling, to be able to improve that immune system, get you feeling more comfortable because now you're not carrying around all this extra weight from the swelling because it's reabsorbed back into the body. And so we'll do that from either like manual lymph drainage massage, which is a specialized technique to go ahead and move the fluid. It's like a lighter version massage. Also potentially compression therapy, if that's something that individual has it is interested in. So that way it helps with the pressure get pushed back in the fluid so it gets reabsorbed. So we look to go ahead and do that with lymphedema treatments. Scoliosis. So physical therapy can work on scoliosis as well. However, our OT team is really excited and they've developed a scoliosis program. So they're excited to share that with y'all. Our next therapy chat that we'll have in the next quarter is actually going to be our OTs, and they're going to actually explain the scoliosis program. So with scoliosis, and I'll just give it like an example, if let's say I had scoliosis and I was off to the side like this, it's probably not going to feel comfortable. Some people with scoliosis don't have a problem with pain or anything like that, and they're okay. Some do. And some of that is a little bit of lack of movement. So they would work on trying to stretch the side that's a little bit more compressed. Try to strengthen the other side. Make sure that your mobility is good, is better, to try to get from here a little bit more up to here. Try to get you more comfortable and trying to get you to move better. And so that was just an example of a curve. There can be several curves going on with scoliosis. Our OT team is really excited to actually have a program to help alleviate any discomfort that you might have from scoliosis as well as any mobility issues. So they will look to help with all those, reduce that pain, improve mobility, improve strength. Sometimes with how you are bent in a scoliosis, you might have actually a hard time breathing. So scoliosis doesn't have to just be sideways. You could be more like this. And if you're more like this, it's really hard to actually expand your breathing. So they can help try to get more people upright to help with overall breathing as well. And then we have the REACH. So REACH, resuming engagement and activities that create happiness. All this is that we've actually tailored specific programs for speech therapy, occupational therapy, and physical therapy for different activities such as like biking, such as tennis, pickleball, anything like that. Let's say is an activity that you love and enjoy, but for some reason there is something that's keeping you from doing it or doing it as long as you would like. We've developed programs for that, for specifically those activities, to get you back into those activities. So this is just a collection of different programs for those activities that we have. And so that's what the abbreviation is resuming engagement and activities that create that happiness. Because we want to get you back to enjoying life, enjoying the things you love to do. Coming later this year, I plan to get POWER certified. So that is Parkinson's Wellness Recovery. So it's another tool to help with the toolbox of treating individuals with Parkinson's. It was founded by Dr. Becky Farley, who is a neuroscientist and physical therapist. And the program that I think most of y'all know, or most have maybe heard of at one time for Parkinson's, is LSVT Big. She's the co-developer of LSVT Big. Coming out of school, I actually was LSVT Big certified and took a lot of those nuggets of information from that. But I wanted something that was a little bit more flexible. So same thing as one of the reasons that I found that Dr. Becky Farley wanted as well. She wanted to create something that's more flexible and not as strict of a program. And so she created POWER. And so later this year, I definitely plan on having that to add that into the toolbox to treat individuals with Parkinson's. How do I access outpatient therapy? So what we encourage generally is to get a referral from your doctor. That way they're already on board, and then you come on in with that referral. However, Florida also has direct access, so you can come to see us without needing a physician essentially on board for 30 days. Because our therapists are able to go ahead and see you for 30 days without needing to send their plan of care that they design to get signed by a physician. We encourage that if you do come in direct access, to have a scheduled visit with your doctor that you would have sign the plan of care very soon after, so that way they're at least aware of the care. What we've kind of found out is that a lot of the doctors, if we go over 30 days, a lot of the physicians like to have seen you, that way to be aware of the care and then be able to sign off on the plan of care. So we do encourage you have that visit set up if you do come in by direct access seeing us first, to at least have that in the background going. As far as insurances, most of y'all have a variation or a insurance that follows Medicare Part B guidelines, and because they do, they accept direct access. And then if you have any questions, we have insurance verifiers that if you provide your insurance information, we can go ahead and help clarify what benefits you have with insurance. So your first therapy visit is that evaluation. So that's a discussion of your goals, and that's a discussion of where we found weaknesses, where we found strengths, and then we create that personalized plan. And by all means, ask questions, because asking those questions in those evaluations helps really determine a better program for y'all. Some of the common concerns with therapy is I'm too old for therapy. We've heard that one. So therapy is for all ages because we tailor the program to where your current level is. So if your level needs a lot of attention, there's a lot of mobility deficits. It's not that we design a program that's like, all right, a boot camp, we're getting you running and moving and squatting. We tailor it to where you're at and then slowly progress from there. And you're never too old because usually, most people want to feel better in their day-to-day lives, and so we're able to do that from any level. It will hurt. So therapy is going to be safe. It should be safe. And if you're having high levels of pain, we're going to use techniques to reduce that pain. We would never want you to do activities that's going to put you in high pain levels, because that's actually just going to be more indicative of being irritating, and then also keep the pain levels to be high. You should never be doing some motions through a high pain level, because it's just going to irritate. So we tailor our programming to that way we're doing movements that are not causing those high pain levels. I don't want to be pushed. Now, some people need a little push, a little bit of a challenge to get them to progress and do better. So what this means is, if your level is here, we're not going to give you levels of activity that are like here. This isn't like drill sergeant hat, boot camp, have a whistle, and getting you to do things. No, we're going to be giving you a little push to try to elevate your levels progressively. So those overall benefits: stay independent longer, keep you enjoying life, improve safety, confidence, reduce that pain, that discomfort. Just stay active in hobbies that you like to do, because a lot of those hobbies are community driven, and you're with other people, and you're connecting, and you're being a more part of each other's lives and community. And so we want to keep you doing that. So overall, you deserve to live well. I like seeing all y'all happy and healthy and moving around and enjoying your life, seeing the smiles, waving at you every day. It's one of the reasons I love that we moved to the center instead of Oak Park, is that I get to see all of y'all in the hallways and wave all to y'all. So that's really fun and exciting. And I really do want the best for all of y'all. Those little and small improvements make a big difference. Any little small improvement that you can make in your life, generally, even if it's a little less pain, usually you notice it and it makes a really big deal. So definitely come out to see us if you have any questions. We have our number here. If you call any of the John Knox numbers, If you use extension 2705, you will get us directly. More likely than not, I'll probably be the one answering the phone, but any one of our team over there in outpatient therapy will answer your question, get you the help you need. Now, if y'all have any questions, I will do my best to pass it along to somebody else. No, I'm kidding. If you have any questions, I will do my best to answer them. Okay? So I appreciate your time. Any questions? Terry in the back.
Are your services equally accessible to people outside John Knox?
Yes. So as far as anyone outside of John Knox can come into outpatient therapy as well. We do get individuals around from the community for all the services, aquatic therapy, CNS, PT, OT, speech, all of it. Mm-hmm. T? Yes. So we go ahead and discuss it with you as far as what you're okay with, as far as what you want to do. And then we go ahead and get you shifted over into a different category as well. That may look like you're seeing one individual and then you just totally need to see a different therapist because maybe they're more specialized for what you want to actually achieve. That may be the case. It may be the case that you're seeing OT or PT and then speech therapy needs to be involved. And so then we talk with you about, do you want to go ahead and do that? Do you have it in your schedule to be able to do both therapies? And then we plan accordingly. So absolutely. Any other questions? Jerry? So we will verify that before we go ahead and try to do any additional sessions. So usually yes. Usually yes, but we always run the insurance, verify, they see that we've already started this one therapy as far as like SC, PT, etc. And then if we're going into another one as well, we verify that before we do any treatments. Mm-hmm. For the most part, though, yes. Any other questions? All right. I really appreciate all of you coming out. I appreciate the support. Thank you very much.
Good job, Chris.
Thank you.